Hi, I'm Dr. Jeffrey Hall at Hall Plastic Surgery and Rejuvenation Center. So today I want to talk to you about facial rejuvenation, and in that we need to think about a person today in society can have changes to their face which can make them, let's say, less competitive in the market. So we see older people coming in and wanting to look younger because they're competing with younger people for their jobs. We also talk about people that maybe they've had a lot of sun damage. Maybe they smoke. So they've got changes that have caused them to look older than their stated age. So with a facelift, we can help correct those problems. Definitely when we talk about reshaping the face or changing the appearance of the face, that can cause a lot of anxiety because you don't know what's this going to look like. Well, I think the important thing is to understand where you are today and where you're trying to get to. So in this process of doing an evaluation, we're going to look at your face in multiple areas, including the eyes, the cheeks, the jawline, and the neck, and assess each area and determine what would be the best surgical approach for each problem. So for instance, if you have more changes in the lower face, then we're going to probably need to do a facelift and not do as much on the upper part of the face. My goal in rejuvenating the face is to make it blend in, be harmonious, so that when you walk into a room, you're going to look rested and people aren't going to go, oh, that person's had surgery. I think first identifying your needs as a patient as it relates to your face are of paramount importance. So we're going to spend a lot of time in the front end talking to you, getting information, and trying to get an understanding about your goals. And I think what we don't want to do is assume that everybody needs the same surgical procedure. Definitely there are more aggressive procedures and less aggressive procedures. We want to tailor it so that you get the best result. So we're going to spend a lot of time in the office on your first consultation, typically about an hour, and going through your concerns, looking at before and after pictures, and talking more about the surgery itself and what it entails. Typically we'll have you come back in a second visit. If you want to proceed with the surgery, I'll sit down and spend time talking to you about the risk of the surgery, where your scars will be, and what you can expect in your recovery. After that, we wind up usually scheduling your surgery, and then you would be following up in the office over a scheduled time, usually for the next 2 to 6 weeks. The recovery for a facelift is something that you can expect at about 2 weeks to be back out in the public, probably wearing some makeup. You'll probably have some swelling. I think if you want to look at when you might see the end result and what the facelift is going to be in the end, it's probably 2 to 3 months. Overall, it's a very safe procedure. There are some important anatomy that we want to respect when we do the surgery. Patients are typically happy after the facelift procedure or combination rejuvenation procedures that we might do surgically, such that they're able to get back to doing the things they want to do, and especially they feel mentally a lot better about themselves. I think our, let's say, perspective on our appearance has changed over the years, such that I think we're seeing younger people for consultation for facelifts. I think it's a better situation today to be seen before all the damage has gotten so severe such that the facelift won't give you the best result. So I encourage people, if you have some concern about your face today, don't put it off. Come in, visit with us. In the end, you may say, okay, surgery's great, or you may say, I need to wait. But in any event, you'll feel better knowing what your options are. Again, I'm Dr. Hall at Hall Plastic Surgery and Rejuvenation Center. Hopefully this information has been helpful in considering facial rejuvenation surgery.